My major passion in mental health is to save lives.
Mental health will touch one of us at anyone, at any point in our life.
No matter if you're poor or you're rich, it doesn't matter, it doesn't discriminate.
Everyone's got so many different stories, right? And everyone's is different. Whenever you arrive at work at the beginning of the day, you never know, what stories you're going to hear.
You can be really creative, you can really get to know people and what matters most to them.
Seeing people get better and achieve their potential or something akin to their potential, that's a great motivator. And even now, after all of these years, it's still important to me.
The Illawarra Shoalhaven is a long, narrow district, so we extend from Helensburgh in the north to South Durras in the south. Most of our mental health services sit within Wollongong, Shellharbour, Nowra and then Ulladulla.
We want to keep people in hospital as little as possible and able to sort of set them up and give them the best opportunities in terms of community-based supports that we can. Sometimes we do realise that people have to be in hospital, so we have different levels of care that we need to provide them. So, you've got the high care, the acute wards and then the subacute sort of rehab wards.
And there's so many different opportunities and roles within allied health in mental health, from things like multidisciplinary positions, but also discipline-specific positions. We employ allied health assistants as well as OTs, social workers, diversional therapists, exercise physiologists, dietitians, clinical psychologists, registered psychologists, a whole list of different allied health professions. And I think that the allied health brings a really great, holistic view to our mental health service.
I think we all work together in terms of we understand our role in each section, and we understand that if we can't provide the service that they might need, we are able to refer them onto a more suitable service. I think ISLHD does that pretty well.
Our mental health services can't function in isolation from the rest of the community, so we have key partnerships with community managed organisation and NGOs, as well as other departments within the government.
There's a local graduate medical school here, the University of Wollongong, and they're really, really great. There's a lot of opportunities to work within that department, teaching the medical students, and there's also a really good research infrastructure attached to the hospital itself, but you can also work with some of the academics in the university as well.
It's a local health district that's big enough that there's a lot of opportunities, but also small enough that you can network across teams and services, that you can develop those connections with people.
This is a really good district because I really just think you've got the support that you need to do what you need to do in your career and to be the best you can be for your patients.
Really got a nice vibe. It's more like a family vibe. It's very positive, fun place to work.
You get a lot of chances to try a position or to fill a space when someone's on leave, and you can grow your skills by being open to those opportunities.
If you've got an idea, if you've got something that you're passionate about, this is a safe place to bring it up confidently, talk about it with your management lines and executive, and people will listen. And people will give you a chance to try and do something to make things better.
You can do the work that you would do anywhere, but you can commute 5 or 10 minutes to work, and you can be on the beach at 5:30 and have that wonderful work-life balance.
I guess, obviously work-life balance is definitely key for me. It's one of the main things that drew me back down to the coast, literally just to be near the beach, to surf, to swim.
If you draw a circle around 2 or 3 hour drive, within a couple of hours you can be in Sydney, you can be in Canberra.
You can duck up to Sydney for bigger events and then come back home again on the same day. You get the best of both worlds here, I think. My kid's school has a whale watching platform. I mean, you can't really go past that.
I live on Jervis Bay. I can't believe my luck. I grew up in a really crappy part of northeast England where it's all grey and rainy and cold and the beaches are covered in coal dust. And I walk my dog every morning on the sands of Jervis Bay, and gosh, I feel lucky every morning.
If you're working in, a city that's congested with traffic, you're leaving work at night, you're getting home at night, you're just not enjoying life. I think the Illawarra's got it all. There's so many opportunities here to unwind and to enjoy the lifestyle that you are working for.
No real barriers. You're able to just, explore different ways of thinking, different ways of doing in a safe environment that's supported. And what more could you ask for when you're trying to be, the best clinician to your patients as you possibly can be?